Assalamu alaikum. Exceptional communication day. We will start with this scenario. You are the senior house officer.
بجاي تراب بجاي دار.
Hello.
Sorry. You are the senior house officer looking after yesterday on-call admissions for your team. One of the admission, 18 years old woman, Miss Clayton, with no previous psychiatric history, who took an overdose of paracetamol yesterday. This was small 16 tablet, and her level were unpredictable 6 hours post-overdose. She denies intending to kill herself and says she was confused. Today, the nurse report that she has been verbally aggressive and swearing at staff and thinks they are trying to poison her. She wants to go home with her mother. The mother has asked to speak to you with regard to take her home. The mother feels that this was a one-off issue which won't happen again. Her daughter is far too sensible. Miss Clayton has not yet been assessed by psychiatrists. You will sit with the mother, okay? I will start timer just to be shown to me. I will alarm you 2 minutes before.
Okay.
Here you go.
The timer is showing, I think.
Really? I didn't share.
I'm not sure it's showing. It's okay.
Okay, closed.
Okay.
Try not to
hello?
look at it.
Okay. Now disappeared. Okay. Now it's disappeared. Okay. Hello, my name is Dr. Abdullah. I am one of the doctors here in the ward today. Can I confirm you are Mrs. Clayton?
No, I am her mother, doctor.
I thought because she's Miss Clayton, I thought the mother also Mrs. Clayton.
No.
Okay. Okay. So you are the mother of Miss Clayton?
Yes, I am.
She is 18 years old.
Yes.
Okay, we are here today to discuss the condition of your daughter. Can I confirm you are the next of kin of Miss Clayton?
Yes, I am the one.
Okay, nice to meet you, Miss. Nice to meet you, really. So we are here to discuss the condition of your daughter. Can you tell me more? How much do you know about her condition?
Yeah, doctor. Actually, I'm the one requested to meet you, and I want to take Clayton home. She's not feeling well here.
Okay. Do you know about the circumstances that happened to her before she came to us?
Yeah, doctor. I know everything. She was having a fight with her boyfriend, and after he left her, she took some medicine, and that's it. And I think she's fine now, doctor. Just let her go with me.
Okay. So can I ask who brought her to the hospital? You are the one, or she came alone?
Yeah, I think, doctor, she's the one called the emergency. And I heard after that she called the ambulance and she came to the hospital.
She's living with you at home, or?
Yeah, she is.
She is living with you at home. Okay. So can I ask you what's your expectations from our meeting today?
Yeah, she's fine, and you let her go home with me.
Okay. So, can I ask you some questions regarding what happened? So,
Yes.
did she have any problem with her mood before?
No, doctor, this is the first time, although she's having fight always with her boyfriend.
But she never had any like suicidal attempts before. I'm sorry to ask you this question, but just to make sure that everything is
I'm not
okay.
sure, doctor. She is always locking her door in her room and sitting alone. I don't know if she talked before or no.
Okay, can you tell me how many tablets of this medication? You have been noticed that it was paracetamol, right?
Yes, I saw that the strip and it was paracetamol and all were empty. I think she took one.
One only? One strip, you mean? One
Yes,
complete strip.
one strip. Yes.
Okay. So, did she take any other like medicine with it? or other tablets?
I didn't see, doctor.
Mm.
However, I saw some wine beside her bed.
Okay. Did she was the door locked while she did this?
Yeah,
This
I told you, doctor, she is always locking her door. Yes, she was.
okay. So after this happened, after this medication, she took this tablet or this trip. What happened after that?
I don't know, doctor. I just woke up and I found her not in the room. Then I heard that she left with the ambulance. That's why I came to you. I want to take her home back.
Okay. So I want to explain what's happening regarding our care with her. Now,
Yeah, doctor,
because
please.
yes, so because she took what we consider is what we call a toxic or really harmful dose of paracetamol, and we are thinking also, as you say, that she may be mixed with some alcohol. So such cases really have such cases of taking high doses of paracetamol can be really harmful for her. Like these high doses of paracetamol can lead to some liver damage, and unfortunately, in some cases, this can lead up to even liver some transplantation, what we call transplantation of the liver. That means the liver will be completely failed, that we have to put a new liver for her. Also, it can lead to some kidney damage. She can need something we call dialysis. And also, it has some effect on the in the balance of the blood, as also in the part of the blood that control of bleeding. All of this is very
Doctor, I don't think all this will happen. She will not do it again. Please let me take her home, please, doctor.
So can I ask you why you want to discharge her early or take her home early now?
Yeah, she's not comfortable there in the hospital room. She's telling some of stuff want to poison her. I think she's not feeling well in the hospital, doctor. She will be fine at home.
So let me talk to my staff,
Okay.
and we are going to make sure that she's more comfortable. If anything she needs, we will try to accommodate her needs and everything. But I'm telling you, because of this high dose of paracetamol, she really needs to stay at hospital to give a proper follow-up of this high level of paracetamol and make sure that everything is okay and we can intervene as early as possible if any complication happens.
Okay, doctor.
That,
For how long,
okay.
doctor, you want that?
Now, at least it has to be 3 days, but now it's also early to say. But we have to make her staying with us at least 3 days, and then we will decide. It can be more, but as I told you now, it's early to say. But we have to. This is for the benefit of if your daughter. We have to make sure that everything is okay with her.
Okay,
And this
doctor.
paracetamol did not harm her. And yes, miss.
Yeah,
Yeah.
she's fine, doctor. I can see that in her condition. She's fine. Just let me take her home, and if anything happen, I will bring her home. I will bring her back.
So actually, the other part of our taking care of your daughter is
Yes.
that we have to inform the mood doctor to really assess her.
Oh my God, doctor.
And
Why, doctor? What do you think, doctor?
any patient that have such uh, actually we have to consider what happened with Mrs. Clayton, that this was a suicidal attempt until proved otherwise. So we have really to ask the mood doctor to check her, to check if she has any problem with her mood or if she need any help regarding this issue. And also we have to assess more Miss Clayton to make sure that uh, uh, such such attempt will not happen again in the future. and this is
Oh,
very
doctor,
important for her well-being.
please, doctor,
I'm very sorry.
don't do that, doctor. It will not. It will be written in her file, and it will affect her future, doctor. Please don't do that. 2 minutes left.
Okay, let me ask you, Mrs. Clayton. Sorry, let me ask you. Okay, I will arrange another meeting with my consultant and our mood doctor, just to speak with you more about her condition and
Okay.
our plan for her.
Mhm.
And I wanted to ask you if you what's your, is she working or she's studying? What's her
Yeah,
job?
she's studying, doctor, and you know, such sensitive issue, it might harm her future in the university, and all will know what happened to her. I don't want this to be spread.
Yeah, be assured, be assured that our top priority is to keep the confidentiality of all our patients, and nothing like we cannot break this confidentiality. And be assured our top priority is really helping your daughter, and we cannot cause any harm to her. Just be assured of that. Is that okay with you?
Yeah, doctor, and don't write in her file that she tried to do this as a suicide.
Okay, let me speak with my consultant also, and we will,
Okay.
as I told you, we will arrange with another meeting to speak about all of your other concerns, and just be assured that we are trying to help her. Any other stresses in her life other this problem that she had?
No, I think only the fight with her boyfriend only, and sometimes she's not sleeping well. Yeah.
Okay. So yeah, all of this will be assessed by our social worker, by our mood doctor, and if any help needed, also we will offer it. Is that okay with you, Miss?
Okay,
Is that
doctor,
okay?
but when she will be arranged?
Just I will try to arrange the meeting as soon as possible to meet all of our concerns and to help Miss Clayton as much as possible.
Okay, time
Is
is
that
up.
okay? Okay.
Yes, time is up. Okay. Well done, Dr. Sarah. I couldn't hide the timer anyway. Let's comment.
Yes.
Yes, it's
كان
okay.
واضح طول
At least
بس
don't
أنا
look at it. Yeah, don't
yes
look
I
at it.
tried not to look at it.
Yeah.
Yes.
Okay, let's comment from the beginning. Yes, introduction well, and the question, and you can start this meeting by assuring this meeting will be confidential, top confidential for you and Miss Clayton. This topic is very sensitive, and that's why we are here. And be sure that no one will know about it. Okay, all details of this meeting. This is the first thing to assure. So one of the confidential meeting, you have to assure the suicidal attempt along with the some inherited condition like Huntington and the HIV as well, the coming scenario. So supposed to start with saying this meeting is top confidential. Don't worry, no one will know about it. Okay, this is the introduction. You asked me or you requested to meet me. Why may I know what's your concern? What's concerning you? I want to take my daughter to the home. Why may I know why? Then she will explore to you why she wanted to take her home. And the next task is to ask for the circumstance, what happened. As you said, did she take the whole, how many tablet, any other medication along with, did she take alcohol? And you forget one important thing, the letter. Did you find any letter after she left or after she did that? Did she lock the door? And the good question also you ask, who asked for help, you or she? So yes, most of these questions will guide you if she's trying to kill herself really or just making drama. So if you feel all this question positive and she is trying to kill herself really and serious, uh, you have to detain her. She cannot leave the hospital for any reason until be assessed by the mood doctor, and it will be arranged within 72 hours. Okay, this is the point for any suicidal attempt. If you feel patient will harm herself and she might do it again and she will try again to do the suicide attempt, she can't leave the hospital for any reason. Okay, she will be assessed by mental health team or Mental Health Act detain, and it will be arranged within 72 hours. I'm sorry, we can't leave you or your daughter go home. Why, doctor? What do you think? Why do you think that? Whatever she will do, don't negotiate with her, but try to convince her this is for her safety. The complication, as you said, the liver, the kidney, it might harm and threaten her life. And we are worried maybe she will go home and she will try again. She's precious for us as she's precious to you, and so on. The point here in this scenario, as you raise it late, but you have to raise it early. We should refer her to the mode doctor just to assess if she's fine, she can go home or not. Do you think, doctor, she will try again? Yes, some circumstances in her situation showed that she might do that, and we are worried about that. Doctor, please don't tell anyone. Yes, this is confidential. Please don't write it in the file. Yes, to be sure, we will assist her, because if she left without permission, it might be against her in her file. She will be like absconded, and it will be harming her future. So to be safe from this point, please let her stay here with us. Don't worry, we'll try to make the room comfort for her. We'll try to assess what happened with her, with the nurses, whatever, and we'll try to let her calm at her room. We'll make the situation good for her, okay? And you can thank her at the end. Any other concern? The mood doctor also will see her stress condition in her life. He will try to help her with this, the sleeping, the fight, or any stressful condition in her life. It will be solved by some talking therapy with the mood doctor. Okay, but unfortunately, we can't leave her go home. And the opposite side, when you have scenario, patient is just made drama. She didn't write paper, just she took 2 tablets, and she, for example, she had also fight, but she want to make drama or to do drama for her husband or whosoever. No letter, no lock of the door. She called for help. All these things, and the level of paracetamol, okay. You by yourself, you can assist her. She will be also fine at the hospital. No fighting with anyone, no negotiation with the staff. At this time, yes, you can convince her, but if she insists to go home and you feel that she is fine to go, you can assess this issue and you can let her go. But if you have doubt, don't let her go. If you have even doubt while the circumstances are good and still you feel any doubt, don't let her go. So you have 2 possible scenarios. Either the patient looks serious while doing the suicide attempt. This is by any way she should stay in the hospital, and you have the right to detain her. Okay, the other way or the other side, the other arm, other patient with just no any suicide, no any suicidal thought, just to make drama. This patient know that she will not do it again and she will not be serious in the next time. You can let her go home, but she will sign them. Okay, I hope it's clear.
But has to be psychiatric assessment also, or it's okay?
No. The other one, no need, because you can judge on the circumstances. Did she take it with medication? No. Did she take it with alcohol? No. Did she lock the door? No. Did she write a letter? No. She just took it to make drama, 2 tablets, and that's it. Okay? No need to be assessed. You are the one assessing her. But if you have doubt for any circumstance, like one of them was positive, she locked the door, she wrote a letter, yeah, in this time, and you feel that she need to be assessed by a psychiatrist, you have to refer her to the psychiatrist and you have to detain her. But if not, you can take the decision by yourself. Okay, and by the way,
Okay.
they are not bringing debateful scenario, either clear for suicidal or by mistake. She took paracetamol by mistake. There is scenario patient take paracetamol instead of antibiotic by mistake, and she want to go home. This is clear. It's not suicidal. She took the medication by mistake. So just let her know about the red flag, any change of your color of the skin, any change of the color of your urine or water word. If you feel unwell, if you have any nausea or vomiting, you have to give her red flags before going home. Once she has feeling of this, she will visit the emergency. This is clear, no need for assessment because she took the medication by mistake. Okay, this is another scenario, but it's not suicidal attempt at all. Just took the medication by mistake, and this patient will be safe to go home. You will try to convince her about also the side effect, the complication, the late complication of renal failure. But if she insists, yeah, give her the DAMA and let her go. But you have to give her red flag and safety netting. Okay. But the suicidal attempt patient will be clear she had suicidal attempt and you have to detain her. Clear now?
Yes.
Okay. Any question in this scenario?
Yes, regarding the confidentiality here,
Yes.
why did we discuss the issue with the mother? I think it's.
Yes, good.
I mean, yes, it's.
Yeah, good question. Yeah, because she's the one requested to meet you first, and you can assume that we are getting permission, or assume that there is permission from Clayton. It's confidential issue, but we assume that we got permission from her because
So you
suppose
have to ask for permission at the beginning,
yes,
I think.
exactly,
Yeah.
yes, because yes, this
Mm.
is confidential issue, but the mother aware about the event and she know everything. However, whenever you are talking about the son, the daughter or the son, assume there is permission taken from her. Okay, unless in this scenario you see also written confused. So you can assume that you can't take the permission because she's confused. Sometimes
the
they are
patient
bringing,
is
yeah, they are bringing scenarios like that. Patient dementia. How you will get permission from dementic patients? No permission. You will just talk to the next of kin, which is, for example, in this case, the mother. So if you have any clue in the scenario that the patient lost the consciousness, no need to say permission. But if there is no word pointing that the patient is lost his consciousness, you have to assume there is permission from the daughter, especially this sensitive topic. Clear?
Doctor,
Okay.
excuse me, 2 points. Just I want to
Yes.
you to discuss with me. So about the confidentiality, I believe that if your scenario there is a word confused that you said.
Yes, exactly.
So yeah, so here no need for permission because yes, the patient is not
Yes.
competent.
Yes, exactly.
But can she just say like you are the mother and you are the only next of kin of the
Yes.
of yeah, just to make the examiner know that you know that the
Yeah.
patient is incompetent and
Yes.
you need to discuss without permission.
Yes, exactly.
Second thing, if the scenario say it is not conclusive and the patient might be competent, so in this case, I believe that we can save ourselves by saying to the mother, I just talked to your daughter and she's happy to discuss this with you. Like
Yes.
this, yeah, because the scenario did not order you to discuss with the mother. So that means there is permission. You just say
Exactly.
this word, yeah, to save yourself. My next point
Yes.
is that I like that Dr. Sarah did not use one piece of information in the scenario that the patient is having some things like appear like delusion, like that the nurse is trying to poison her or
Yeah.
something.
Mhm.
So you I was thinking that we can use this to convince the mother that your daughter need psychiatric evaluation, but again, in a second thought, that it is not conclusive also, because the circumstances we don't know about it. Maybe that is true. Maybe the nurse do something like an error or something and fight with the daughter or something. We don't know the circumstances. So I like that she did not say this, but I need your evaluation about this.
Yeah.
Yeah, do you
Okay.
agree with Dr. Sarah, or you have another thing?
Yeah. So any word in the scenario written means something. You have to raise it or to explore it or to discuss it with the mother or with the person you will sit with. So she can use it as a weapon, not to hide it. Because
Yeah.
this is written in the scenario means you can use it.
Can you just, because I cannot see
Yeah.
the scenario, can you just read this line?
Yes,
I don't know why I cannot see the scenario.
in the
So
chat
if
box,
this
you can
line
say.
in the chat box, just a minute,
Okay, I will
because
copy it
if,
again.
yeah, if it is clear mentioned, that means you should use it.
Yes, exactly.
Yeah.
She denies intending to kill herself. Today, the nurses report that she has been verbally aggressive and swearing at stuff and things. They are trying to poison her. Yes. So
yeah,
whenever
so
you
you can
mention,
use this to the mother.
yes,
Yes, you can tell
yes,
the mother, and your daughter is showing some signs that
yeah, she's
are
not fine.
worrying.
Yeah.
She is thinking that the nurse is trying to kill her, to poison her, and
Even
at this
without
point,
details,
yeah,
even
yeah,
doctor,
okay,
you can
even
say
yeah,
she's not behaving well. She's not.
yes,
Yeah, she's
abnormal behavior,
exactly.
yeah,
Yes,
abnormal
she's yeah.
behavior.
For us, she's not fine, and we can't let her go home because she
Yeah.
need to be assessed by the mood doctor. We will try to make this as soon as possible, but at
Mm.
least she should stay in the hospital for a couple of
Mhm.
hours. If she asks exactly as Dr. Sarah said, it was supposed 3 days, 72 hours till to be
Mhm.
by the mood doctor.
Mhm.
Okay.
So Dr. Sarah should notice that if they wrote this clearly like this, you should use it.
Yes,
They are
exactly.
giving you, yeah, they are giving you opportunity to use something.
Yes.
Okay.
Yeah. Always.
Regarding the
Yes.
go ahead,
Continue.
doctor.
No, continue.
Okay, regarding the can you not the concern? Please don't write this in her notes.
Yes.
I could not hear the answer. We
Yes.
can accept not to write it, or we have to write it.
No, we will not try it unless she will be assessed, and if everything okay, will not be written because if she's fine, the doctor assess her and she's okay. So you can use this also as weapon. If she left, she will be against her. So to be free, she should be assessed by the mood doctor. You got it?
So can I just tell you something?
Yeah.
So the event itself should be written because she attempted suicide. This is very important. So, but you can tell the mother that no file should be seen by any other person in the
Exactly.
world
Yes.
without the permission of the patient himself. So we cannot give this file to any university, any work place, any other place, any third part, except with the permission
Except
of the patient himself
okay,
or
and another
his next of
exception.
kin.
You know that another
Mhm.
exception, if she escaped from the hospital and they will write in the file absconded, this one will be against her, right?
Yes, 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 yes.
Even without
So we,
without her permission. Why she left the
yes.
hospital? If she is fine and she is competent, let her
Mhm.
stay till the end. If everything happened okay and the assessment by the mood doctor showed that everything is okay, it will be in the file with no
Mhm.
it will not be
Mhm.
known by others. But
Yes.
once she escaped from the hospital, it will be absconded, and this absconded will be bolded in her file.
Mhm.
Isn't?
Mhm.
You know that any
Yes.
patient going from the hospital as absconded, it will be showed in his file, shown in
Yeah.
his file, absconded. and this thing will affect the future because
Will
why
be
she
against her. Yes.
yes, why she left without permission and without seeing other patient, other doctor.
Further evaluation. So
Yes,
I got
exactly.
you. So I got you.
Yes,
But the main issue, to be clear for the patient and the next of kin of the patient and the mother, that the file will
yes,
never be
yes, of
shown to
course,
anybody without the permission. But
exactly.
if
Yes,
you complete the evaluation, the things will be in her best interest, because it
exactly.
will be written clearly that she attempted suicide, but she's okay.
Yes,
But if she run away, the file, it
exactly.
will be that she attempted suicide and she is not okay.
I'm
So
afraid to say
that is the
yes.
thing.
It will
Yeah.
be documented in her file that she absconded.
Yeah. Okay. Okay. Thank you.
So the
Yes,
best.
Dr. Bassam, this was my question. If she goes to the university, the file, are they
No, no,
showing
no.
the medical file? No, no, right?
No, 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 no. No
I
one will
said no
show. The
because I
only,
was.
yes, the only
No, they will
thing.
not. No,
Yes, yes.
not without her permission. I
No,
think they will
Okay.
do new evaluation for her. Whenever you are going to work or university or something,
yes.
they are
After,
usually
yes,
doing new evaluation. They are doing
yes.
new evaluation.
And also, the thing will be spread or shown to others whenever she is absconded, and like she's not taking the full assessment, and she left after this event. This thing will be against her, and try to do as to take it as a weapon for her safety. Let her stay. If she left without any our permission, it will be documented in her file like absconded. But don't go to this negotiation with the mother. Try to convince her by any way. If she insists at the end, to try to arrange meeting. If she insists, you can tell her this sentence. Okay,
Okay. So in
as you
this
did.
scenario, we will tell her it will not be shown, even to
No,
the
no,
university
nothing,
if she
nothing. It
asks
will
no
not be
messages.
shown. No, no, nothing will be shown for any. This medical file and medical report will not be shown to others unless she scanned it from the hospital. And the other thing, if you are in doubt, as you did, Dr. Saab, yes, if you stuck with the family or with the patient or with the relative, okay, go to the last option. I can arrange a meeting with my consultant. He has good way and best way to convince and to address your concern better than me. That's it.
Okay. And the other point that was raised regarding that we have to tell the mother that she has what now? Some psychiatric issues because of the behavior, or no need to mention that also?
You can
Because we're
mention
not
that.
sure about the diagnosis, right?
No,
Okay.
no, you can mention because the
Okay.
circumstance also it's debating, right? You feel that she's not fine.
Yes,
Fine.
yes.
She did something which is wrong. She locked the door, although she called for help, but she talked with alcohol. If you tell me there was in a paper or letter, yes, there was a letter. So
No, I meant the behavior changes in the hospital or in the
yes,
psychiatric ward.
you can say it. Yes, you can
Okay.
say yes. Your daughter also behaving abnormal in the hospital, and for this she should be seen by our mood doctor. Okay.
Okay. Okay.
Yes, okay. Let's if no one question, if no more question, we can go to next scenario. Any question from others? Let's see the comment. If the mother is not aware of suicide attempt, we shouldn't discuss that, right? Yes, but she's aware because she came and she requested to meet you. They will not bring a scenario without permission of the mother, for example. But there is scenario. I remember there is scenario with the son took medication, recreational drugs, and he has seizure, and he is 16 years, yes. And your role to sit with the mother, or I think the mother, yes, and to talk about what happened with him. But that scenario is different because the mother doesn't know what happened. Here, the mother know. She knows that there is fight, and she took some medicine. She knows everything. She found the strip, and she found the wine, and she knows that she called the ambulance. So the circumstance known by the mother. But the other scenario, the patient took the recreational drug. He has seizure with his friends. He was in the party with his celebrating in the party with his friends, and no one knows what happened with him. He came to the hospital with seizure, and the mother want to know what happened. In this scenario, you'll not tell that he took recreational drugs. This is confidential, and she doesn't know already. But here she knows. This is the difference between two scenarios. Clear, Dr. Qadi? Okay, let's read the scenario for HIV. This is another high topic scenario. I hope.
Before going on to the next topic,
sure,
please.
sure.
You said the patient was 16 and his mother didn't know what happened and so on. So 16 is incompetent. I mean, we have to tell the mother, right?
No, I think it's 16 and after.
Or
they
not
have
18?
One time they said 18, and another times one said 16. I'm not sure which one is. Anyway, less than 16, yes, you can. But if more, you can't. Okay. I guess also they will not give you borderline. They will give you clear age, like 20 or 22 or whatever.
Okay.
Not in the borderline. But if less than, it's okay. She should know. But they will not bring also scenario with less than 16 child, I mean.
Yes, and not our specialty.
Yeah, yes, exactly. But this tricky scenario is a very old scenario. I don't know if they are repeating.
I read it somewhere, but I don't know the answer. I only read. I can share it and we can discuss it together after the session.
No problem. Okay.
But I don't know the answer actually. Okay, you can go on. Okay. Thank you, Doctor.
Most welcome, Doctor. Yeah, I think 18 also, Dr. Qadi, but someone working in UK said 16, or maybe UK and Ireland, they are different in the age. I don't remember, but someone said 16 and others said 18. When we discussed the issue of screening for Huntington, when the boy can take the decision, someone say 16 and another says 18. One of the doctor working in UK. We can ask in the group also to be sure which age exactly. Anyway, we will not bring in the borderline scenario.
Dr. Basma, about sign Dama, are you sure about this point?
Yes.
This patient not under the mental act, يعني?
No, this patient, no. I meant another patient. I didn't say Dama for this patient.
So this patient, if you want to, because you said
No, Dr. Aisha, I
home...
said in another patient who took the medication by mistake, or the patient took 2 tablets and she will not repeat it again, and you are sure the circumstances were good. She's not meaning to do suicide, just to make drama for her husband or whosoever. Okay? If no serious suicide attempt, never ever she will leave the hospital until or unless be seen by the psychiatrist.
And about taking history here, it is
you can take history. 2 scenarios you can take history in. HIV, the one I will do now. Yes, and the needle sick. Yes, and the suicidal attempt. These are the only 2 scenarios you can ask question, and not every history, only the circumstances, what happened exactly. That's it. Okay.
Yeah. Clear? Okay. Clear. Thank you.
And IBS, I think also. That's right. IBS.
Irritable bowel, yeah. Irritable bowel,
Yes,
like stress, not full history, stressful condition, the job, the sleep. But
this is normal, the social, but no, other than
social. And if you feel that you are going to take history, you can do it as an instruction, especially the sleep. Maybe the sleep, like taking history. So you can ask him, please, if you are not sleeping well, please try to sleep well nowadays, because the less sleep or the sleeplessness can initiate or can increase the risk of having symptoms and so on. But for example, the job, no problem, no issue at all for the job. For a question by stressful condition in your life, this is no problem. You can ask. if you will go deep more, like sleep, the mood, if you feel this question will put you under the term of taking history, do it as instruction. Please do. If you have any mood change nowadays, you have to take rest. If you have less sleepless or sleeplessness, you have to get you have to get good rest, like that. Instruction without asking, okay? Okay, Dr. Qadi asking again. I am asking about the scenario of consultant diagnosis stroke. Then the radiologist says SOL, spatial organ. Is it error? We are confused. Some mentor say it is not an error. Some, yes, it's not error. Please tell, what do you think? Yes, I will tell you, Dr. Qadi. We have discussed this scenario before. So the CT brain, after the CT brain will be done, what suppose the policy do? To be seen by radiology, right? Okay, and to be seen by radiology when you have radiology on call, radiologist on call for the night. For example, patient came in this time and the CT done showed query mass, query hemorrhage, and the radiologist on call, he reviewed the CT and he put initial report. Clear? Till now it's clear, right? And this is the policy. Okay, in the morning, the consultant will come, the meeting, they will read the CT and they will put official report. Maybe they will correct, maybe they will fix whatever. But in this time, this is the last official report. And supposed to be in the morning. The consultant will not come on after week. If everything happen in these steps, no error at all. If anything away from these steps, it's an error. For example, the radiologist read it as hemorrhage, and it's a special occupying lesion. Then they started the medication and so on. Then in the morning, the consultant didn't see the CT, the report not yet finalized, and the medication continued. So this is error, right? Should be reviewed by the consultant and the report should be finalized. But if the consultant didn't come for any reason, he didn't review the CT, and the one who read the CT was the radiology on call, okay, respect the radiologist on call. But till what time? Till the consultant will be seen the CT and he will read it as a final report. Till now, no error. If
Dr. Bassel?
Yes.
Because I need to be in the same track with you. So in NHS or in England, the one who's responsible for the finalizing the report of the is the radiologist.
Yes, exactly.
The consultant should not act upon his observations until he is very sure, and if anything happened against his observation, this is an error. Again, because I heard that from somebody work in.
Again, if anything happened against,
that will not be an error unless something happens. Can you hear me? An error will not be an error unless something happens. Say, for example, they open the brain, but they didn't find the diagnosis right. So they open it unnecessary. Based on who? If it is based on the radiologist is the responsible one. He should bring the evidence that why he thinks that it is hemorrhage, why he let the surgeon open the brain based on his observation. Okay, he can defend himself like this, pathologically or clinically, or upon his observation of reading in the CT. Okay. But the consultant cannot do that. The consultant will not be excused because you open the skull of the patient to evacuate a hemorrhage that you think it is there, although the report by the radiologist say it is not. Nobody will excuse the consultant. Yes, nobody will excuse the consultant. Yes, this is different, but just I give you the example because, yeah, I will tell you that the radiologist can defend himself based on 1, 2, 3, but the consultant cannot defend himself because he acts against the radiologist report.
Yes, doctor.
And, and the one who's responsible is the radiologist.
Exactly.
So he should not act against the radiologist report unless he's sure, and if any error happened, he should be responsible for this error.
Yeah, yes, but you are talking about different scenario, I guess, because doctor, that the scenario you are saying is surgery after reading a CT, and I think the decision for opening or for surgery will not be taken immediately unless it's clear epidural, for example. No similarity with other. I mean epidural equal epidural clear for the neurosurgeon, for the radiologist. No debate and no conflict about epidural. But the scenario here, Dr. Qadi shared about space occupying lesion or hemorrhage intracranial. So I guess, this is different scenario. So there will be a debate by anyway, because they are similar in the presentation and similar in the
Where is the
radiological finding.
debate? Excuse
The
me,
debate,
I cannot understand.
yes, the debate. Patient underwent the CT 12 a.m. like now, okay, and they suspect stroke, not hemorrhage. Okay, this is the scenario. Suspect stroke, and they started, for example, medication for stroke, antiplatelet or whatever. Then in the morning, the consultant the consultant came and he said, no, it's not a hemorrhage, it's space occupying lesion. So it's not stroke, and this is space occupying lesion. You shouldn't start anti-epileptic anti-ischemic or anti-platelet. This is the debate. Why he started before finalizing the report, and the debate will be more clear if the delay of the reading CT
So who started?
happened.
Who
Yes,
started that?
this is the
So
problem.
this is an error.
Sometimes
This is an error. Yes.
error, exactly.
Yeah,
But
this is clear
wait.
error.
No, it's not error unless it's read by the radiologist on call. This is if the radiologist on call read the CT, this is not error. But if you are the one urologist, read the CT and you suspect and you decided from your mind, your own mind, this is the error.
Error, yes.
Yeah,
We
the
agree.
policy,
So we agree. Yeah.
The policy always, the radiology should read the CT. But also, if the radiologist, the registrar, for example, read the CT now, for example, overnight, and supposed to be finalized in the morning by the radiologist, consultant radiologist, and the consultant radiologist didn't attend, and the CT stayed for 40 or 48 hours, and patient, for example, developed hemorrhage because of this bleeding, this is an error also. Suppose the consultant will finalize the report in the morning, right? Every day, the CT, the radiology department doing the meeting for the night and the whole 24 hours images. They are reviewing, they are finalizing, and they are agree for either to agree about the report, initial report, or to change or to fix whatever. Clear? But if they didn't do the meeting and the consultant away from the hospital and he didn't come to this meeting and no final report for this meeting, for this CT, and the patient continued on the anti-epileptic medication, although the radiologist on call read the CT, yes, registrar, but still the CT should be reviewed by the consultant in the morning, not to be wait for 48 hours. Why? Where is the consultant? Where is the meeting to be done? I think clear now, right? This is also the policy in our hospital.
Because we speak in the hospital about the hospital. We speak in the Yeah, when we are speaking to the patient, we are speaking about the whole hospital, not about us or me, the registrar who give the treatment. No,
Yes.
we are speaking about the hospital. So there is an error in the hospital. That is a delay in reading the CT.
Exactly. Not
Yeah,
reading
so
in confirming by
yeah,
consultant. The
yeah,
radiologist on call, he can read it.
yes,
Okay. This is not error. If the radiologist on call, registrar read it till the morning, it's not error. He can also call his consultant on call. He can review it with him. But for example, let's say it's 6 hours only. But if delayed like 24 hours or 72 hours, not reviewed, and when the consultant came and he reviewed the CT and it showed that there is suspicious of mass, this is delay. It's clear now. I think, Dr. Qadi, my error clear regarding the consultant read the CT late after 12 hours, after 72 hours from the event. Why he's late to read the CT, or why he review the CT late? I think this is clear now. Yeah. When the CT report finalized late, this is the error. Or if the neurologist himself read the CT, this is another error. Apart from this, no error. If the radiologist read it in the night and the morning consultant review it and he said it's not, yes, this is, he review it in the time, this is not error. I think it's clear. Okay, Doctor.
I think he has another question.
How come is it not
Yeah.
error? It is not error. It is misdiagnosis and not adverse effect or accepted complication. What you are talking about? Which one? Misdiagnosis by whom? By the radiologist? Even if misdiagnosed by radiologist, and it came, the radiologist consultant came in the morning and he changed the diagnosis, it's not error. Because the radiologist already reported it. Whatever he wrote in the report, even he misdiagnosed it. But in the morning, as soon as possible, the consultant review it and he changed the diagnosis. This is not error for me. Oh, by the way, the radiologist on call, he always review the image with the consultant. He's not putting image or report without reviewing the consultant on call. But who will change the report in the morning? Sometimes the meeting, when they are together, 2-3 consultants, they are seeing the picture together and they have deal, no, this is another diagnosis. Then they will change the diagnosis. This is what I practice and this is what I know up to my best knowledge, okay? To cut the story short, let's go to the second scenario. Sorry for being a long session, Dr. Sarah. Let's start again. Okay, where is the scenario? We can do this scenario in next. I mean, CT and the debate about the radiology and the report. Okay, 27 years, Mrs. Micheli, a nurse in your medical unit, when she tried to have a sample from one patient who was known to have HIV. She had a needle stick injury. She is very anxious since that event and want to discuss with you this issue. You are the senior health officer of the medical department on call today. You have been asked to discuss here this issue. Okay, let's start straight away, Dr. Sarah.
Okay. I can.
Just allow me 2 minutes left. I will not look to the timer, okay?
Okay, I can put my own stopwatch outside. Like, I can start my own.
Share it. I will share it, but I will not look.
Okay.
Yes. Yeah. Hello.
Hello.
I'm Dr. Mukhtar, the doctor in the ward today. You must be Mrs. Mitchell.
Yeah, I am. Yeah, I'm Mrs. Mitchell.
And you are 27 years.
Yes, doctor.
Yeah, I have been asked to visit to sit with you. Are you okay now, Mrs. Mitchell?
Yes, doctor, I'm okay. I'm actually one of the nurses in your ward.
Yeah, I know. Yeah, that's why I'm here to sit with you and just to address your concern. How do you feel now?
I'm really worried, doctor. I'm really worried and anxious. And I really need help regarding what happened to me.
Yeah, I appreciate your worry, Mrs. Mitchell. And to reassure you, first, this meeting will be confidential. Okay, top confidential. No one will know about the details, only me and you. Is that okay for you?
Yes, okay, doctor.
Okay, the second point, Mrs. Mitchell, you are not the first and or the last one get needle stick. All of us had this before. Don't worry about that. The most important thing is to know how to prevent it and how to deal with it. Are you following me?
Yes, doctor. Yes.
Yeah. So before going further, can I ask you some question?
Yes. Okay, sure, doctor.
Yeah. May I ask if you have pricked deeply by this needle?
Yes, doctor. Actually, this was the day. This was yesterday. Actually, I was really following everything we teach, everything we learned, and really I was managing this patient. But he is known to have this HIV. But unfortunately, this is really was unexpected. I got the needle prick from dealing with him.
Yeah, I'm so sorry about what happened to you, Mrs. Mitchell. And be sure that we are here to offer you the maximum support. Uh, I ask you how deep the needle pricked your skin. How deep? Was it deep?
I think yes, it was deep, doctor, because yeah, I think it's deep, doctor.
Yeah. And was it soaked with blood?
Yes.
And the size was big?
No, it was the small needle just to get some,
Okay, good.
yeah.
Yeah. Okay. Another question, Ms. Mitchell. Uh, did you wear two gloves at that time, or it was single?
No, I used two gloves, doctor, because really, he's a HIV patient, so I was worried.
Yeah, great. Did you squeeze your finger after the break?
Yes, doctor. Yes. I squeezed, and some blood came out.
Okay. And did you wash it with alcohol or with soap and water?
Yes, doctor. I was really going every step of our protocol. Really, I was really
Yeah,
worried.
great.
So.
Yes, let me assure you, Mrs. Mitchell, the percentage of HIV to be transmitted in your condition or in needle stick is just 0.3%.
Okay, doctor.
Yeah, so it's very few percent. So I want to reassure you that, however, we have to do some tests, as you know, Mrs. Mitchell.
Okay.
Okay. Starting from now, we will do screening for the HIV to be sure that you don't have the HIV from before. Is that clear?
Okay. Yes, okay.
Yes. And also, we have to repeat the test again after 1 month to check if you have any antibodies. And after reviewing also, the result will take it from you now. Is that clear?
Yes, doctor. Yes.
Yeah. As soon as possible, Mrs. Mitchell, you have to take some medicine also. It's called prophylactic post-exposure for HIV. You will take it for 1 month, sorry. And regardless any side effect of this medication, any medication has side effect. Whatever the side effect happen, please do not stop this medication. We want to be sure that even if there is any risk of infection, you will be received this medication and it will help us to eradicate this virus if already transferred. Are you following me?
Yes, doctor, but I'm really worried what will happen if this test came positive. I'm really worried about that.
Don't worry, Miss Mitchell. We are here all supporting you. I will talk to the supervisor after your permission, and we'll tell her about the event, and we will write the incident report for this event to prevent this happen from to other stuff and for other stuff, and for you as well. And we'll give you today sick leave. You can go home, take rest, don't think more, and we will call you back to review the result. It will be handed to you personally.
Okay,
That
sounds good, Dr. Hayes, please. Yeah, I'm really anxious and stressed. Yeah.
okay?
Go-
Yes, I appreciate your worry, Mrs. Mitchell. Till that time, it's Mrs. Mitchell. I can give you some instruction. You might know this instruction, but I have to repeat it. Do not donate the blood in these coming days. Don't share your private tools with your boyfriend. And if you have baby, also there is some instruction regarding breastfeeding and so on. Are you aware about this?
yes, Dr. Hayes, I'm already, yes, okay. That's okay.
Okay. Are you pregnant by any chance?
No, I'm not, Dr. My
Okay, any
children
plans?
actually are really already at school. And no, I'm not no more plan to have any more children.
Okay, great. You have any concern, Mrs. Mitchell, so far?
So I hear that this will affect my insurance, doctor? Or
Actually, I appreciate your concern. The insurance will be affected only if you have positive test. I mean, from previous infection, but any affection while doing your work, it will not harm your insurance. Did you get that?
yeah, okay, sounds good, doctor.
Yes, even though we can give you compensation if you got this infection from this needle prick.
Okay.
Okay. Apart from this, Mrs. Mitchell, we will transfer you to another ward after talking with the nurse supervisor to reallocate you with the in a department in which you are not dealing with patient, maybe some paperwork only, in order to prevent any further needle stick. Is that okay for you?
2 minutes remaining, yes.
Okay, you have any concern?
No, I think I covered everything, doctor. Just I will try to follow your instructions for the lifestyle also. Thank you.
Yeah, okay. Again, as I have been discussed, we will give you today as a sick leave. You have anyone to drive you home, or we can arrange for you someone to take you home.
It's okay. I have my own car.
Okay. What the time now? Any other concern?
No, doctor.
Okay. I will hand you some leaflet brochure website about the needle stick instruction before and after, and the prophylaxis, the medication I prescribe for you. You will take it, and the side effect, the possible side effect of this medication, and the compliance and the importance to compliant to this medication.
Okay, sure.
Okay. Yes. You have any other concern?
No, doctor.
Okay, who's dependent on you?
I am working and nobody's dependent. Sorry, my children are dependent on me. Me and my husband, yes.
Okay, and do you need any support at home?
No, it's okay. I'm a teenager.
Okay, and do you drink alcohol?
Only in the weekends, doctor, and just in the weekends.
Do you smoke?
No, doctor.
Okay. Okay, Miss Mitchell. I hope you are feeling fine now.
Yeah, I feel better after the meeting, doctor. Yeah, thank you so much. Thank
Okay,
you.
and this is also the hospital contact number, our occupational team number. Time is up finally.
Actually, yes. This is what I'm not sure what you have to do if time is Is really, mashallah, stretching. I don't know.
I didn't look, and I asked you what the time now. You didn't answer me.
I
It's
know
okay.
they will not tell you. I did not tell you
No.
because the exam they will not give you any
No,
clue.
they will tell us 2 minutes left.
Oh, no, yeah,
No.
I told you 2 minutes. I told you 2 minutes.
I
I
didn't
said
hear
2
it.
minutes.
Okay. No, it's
When
okay.
it
I
came
didn't hear
8,
it.
when it came
No, I
8, I
didn't
told you
hear
2
it.
minutes. Okay.
Okay. It's okay. Thank
No,
you.
but because you asked me again at 9, I did not know that you did not hear me at. I
No,
told
I
you at
didn't.
8, 2 minutes remaining, but at 9 they
I
will not
didn't.
tell you any.
No, I didn't hear the 2 minutes. Then.
Okay.
Okay, thank you. Yeah, your comment.
So yes, actually this is the case. I think these scenarios have two parts. One before getting or one with the risk getting risk of HIV, and another one after confirmation of HIV positive. I think they are the same, but here it will be different. That you have to get the circumstances. Sorry, not the same. I'm sorry. It will be different here and before getting the results.
Yes. No. Hello, Dr. Farah. Hello.
Hello. I'm sorry. My mobile, I don't know, it's hung. Sorry, I'm not sure what happened. Sorry.
Okay, then.
Yeah. So one of the scenarios like this will be the risk of getting HIV, the risk any risk behavior. Here it will be the needle brick. So first of all, you have, as you did, well done, Dr. Besam. You first got you asked about the circumstances, and you made sure that she got around the correct steps of managing this issue. I think some people also recommended to ask about if she is the hepatitis B virus vaccinated or not, because
Yes, you're right. I missed. Yes, you're right.
yes, because the needle brick has also other.
Yes.
We are not sure if the patient is HIV only or he has other bloodstream infections.
Exactly.
Or blood, yeah. So you have to ask if she is hepatitis B vaccinated or not. Most of the medical staff nowadays are vaccinated. Most of people actually are hepatitis B vaccinated, but also you have to make sure. Then
Yes.
after that, you have to tell her about the HIV test. I think it's 1 month. Sorry, it's now and then after 3 months. I'm not sure it's 1 month. I think it's after 3 months.
3 months for antibody and antigen after 1 month. B24.
Okay. Okay. This is new for me. Okay. What I know is that you offer sorry, now and then after 3 months and until the seroconversion or the test will be positive, the HIV antibody. And if it comes positive, the HIV antibody, you will tell her that there will be a confirmation test by the other test, the Western blot, I think. But she's a nurse anyway, so she will understand that there will be 2 tests supposed to be. Also, you will offer her a screening for other.
Yes, hepatitis. Yes.
Yeah, screening hepatitis B, hepatitis C, and then you will tell her that if she is HIV, of course you will do incident report to save her right, and if she will need any compensation in the future. But if she is HIV positive, she will lose insurance. This is what I know. Even during work, this is what I heard, or this is what I have read before.
If she is before.
But if she
will lose the current insurance, or she will not be able to renew the insurance.
This is even if she got a new HIV, right?
No. If she got
was
HIV before the job, means
No.
she has antibodies now.
No. If she has acquired HIV, unfortunately, she will lose the insurance. This is what I know, because
the current insurance that she has, she will not lose it, but the next insurance, the future one, she cannot renew it, or
she cannot renew. Yes, that's what I know.
Or something. Yes. Yeah. So the problem will be with the renewal of the insurance. Okay.
Yeah. Yes.
This is because you have to speak about the HIV test advantage and disadvantage. So the disadvantage of the test that she will use future insurance. Now, yes, the current insurance she will not lose, but the future insurance or any prior insurance she will keep. But other future insurances she will lose.
Yes.
The other drawback is the lifestyle and the job. So the lifestyle that she will have to keep specific hygienic precautions. She has to keep her own. Yes, her own.
I miss the protected sex. Oh my god.
Yes, and the protected sex. She has, and some people will tell, not now, but if she become, this is the other scenario, if she's HIV positive, that she has to inform the partner. But here, no need to mention that you have to inform the partner, as we are not sure about the results yet.
Yes.
Yeah. So what else? Yeah, the positive side is that she will have
Compensation.
early diagnosis. She can have some compensation and early management, and yeah, and so on. Also, some people recommend that until if the first test is negative, during this 3 months or 1 month, she has to report if any positive symptoms of HIV, like any fever, any sore throat, any lumps, or any lymph nodes. I mean,
yeah, seroconversion syndrome.
Yes, she has to inform, and also you have to inform her that there is a difference. You have to inform her even if she did not bring it up, that there is difference between HIV and AIDS.
Yes.
The AIDS is really about immune compromisation and immune suppression and having a
opportunistic infection.
Yes, opportunistic infection. She's a nurse anyway, so she will it will be easier to read. About the prophylaxis, the prophylaxis, it will be, I think, on the risk of needle prick. You have to start it directly.
Yes, immediately. Yes, within 24 hours.
Yes. And you're going to refer her to the clinic for infectious disease clinic to start her. Regarding the drawbacks for the job, that she will that most probably she will get reallocation, but I think this is after the test results. I'm not sure if before. I think it's after the test result.
Even.
No, before the test. Okay. Yeah, immediately.
Okay, so she will get reallocated to maybe an office work. We have to inform the occupational health worker or health physician that he will reallocate her. And then the social history a little bit, and what else?
So if she says she doesn't want anyone to know, her colleagues and the social workers and
yes.
I mean occupational worker.
No,
what do we do?
No, but no, the occupational health worker. Unfortunately, this is the drawback of the test. If she is positive, she has, because this is one of the questions that she can bring it up.
Yeah.
If she is
for
positive,
the purpose of sick leave, they will know, because they will know the results.
Unfortunately, yes, you have to tell her that both the partner and the occupational health worker or the health physician has to know.
Yeah.
Both of them has to know, and also her GP, the follow-up. It has to be known. It cannot be.
So HIV is one of the cases that we breach. Yes, we breach.
No, not notifiable.
Yes,
not notifiable. No, not notifiable.
Not notifiable to NHS, right? But
No. HIV is a patient has the right to not say to his GP that he has HIV.
But how he will follow up?
No, he will follow up with his HIV doctor. There is a doctor for
this. What about the medication?
If the patient, the needle stick injury, the HIV will be less to be transmitted with the needle stick injury. But we can give them a post-exposure prophylaxis within 72 hours. Okay?
No,
and for the HIV, only if he's HIV positive, he will inform his partner. Okay? Or the previous partner. He will inform his partner or the previous partner if he has many casual partners. Okay, if we will tell him to tell his partner and tell him this, if he won't tell the partner may have HIV and can transmit it to the kids and can have AIDS, develop to AIDS. And if he refuse, then we will make partner notification. We breach confidentiality to the partner only, but the GP doesn't have the right to know that the patient has HIV. This is very confidential. I'm working with the HIV. I'm working as a registrar with HIV. So I need to take the permission of the patient to tell the GP. If you want to tell your GP about your diagnosis, some patients say, no, I don't want my GP to know about the HIV, so they won't know. He will follow up in the HIV clinic.
But the occupational health, he has the right to know, right? Because this is safety of the patient. So the occupational health.
The occupational health, anyone they can know, but the occupational health he doesn't have role in the HIV treatment or management. They will say he has HIV or not. And even post-exposure prophylaxis, he's taking it he can take it from any sexual health care. Okay?
But I mean, if she's HIV positive, and the occupational health physician, the occupational health physician has to know for the safety of the patients, right?
Anyone has a needle stick injury in the hospital, he will go to the occupational health and they will do for him the test after 3 months. And he will take the post-exposure prophylaxis for 28 days. So they will know, but for the GP, he shouldn't know. If the patient doesn't want to inform his GP, he is not allowed to breach confidentiality.
I think I understand you.
Yes.
The point that she's trying to tell you about that the HIV patient, the needle stick injury in the hospital should be dealt with the infection control department, not the occupational department.
Occupational health, not the needle stick injury will be dealt with the occupational health. Infection control only to prevent infection in the hospital, the MARSA, the CD. Infection control has no relation with the needle stick injury. You will go to the occupational health, they will check the immunization, they give the hepatitis B immunoglobulin, they will give the hepatitis B vaccine, and they will ask you to follow up after 3 months. Because I have one needle stick injury, and the occupational health will calling me after 3 months to come to have to repeat the test.
Okay, so the occupational test department should be notified about this condition.
Yes,
that is the question.
Any hospital there is occupational health. So when you got the needle stick injury, you will go to the occupational health, you notify them, and then you can go to the A&E to take the vaccination for hepatitis B. And they can, if it's high risk, or the patient is HIV positive with detectable viral load, so he can take the post-exposure prophylaxis. He will take the Truvada and Raltegravir for 28 days. Okay. But if the patient has undetectable viral load, so it's untransmissible. So no need to take the post-exposure prophylaxis. If the patient is HIV positive with undetectable viral load, no need to take the post-exposure prophylaxis. Because the undetectable is untransmissible.
Okay, but in BASIS exam, I think the rule to tell the patient that they will start the antiretroviral
within 72
post-exposure
post-exposure prophylaxis within 72 hours.
Yes.
This is the rule in the BASIS. Yeah, regardless what is happening in your hospital. But here the rule, we should in the conversation tell the nurse that she will start the post-prophylaxis treatment immediately in the 72 hours. So this is number one. Number two, it is notifiable to the occupational health department only. If she told you, I don't want anybody else to know, this is her right until she will test positive for HIV. Then after testing positive in HIV, also there is a debate, because they said also you should not tell her that I will notify your partner. Even after telling her, and she is still, you told her everything to convince her, but she still don't want to tell her partner after HIV, not in the here. If after came positive, she is now an HIV patient positive. So if you will tell her, you should tell the partner. If she said no, don't tell. You will tell her that if the partner got HIV and he has the right to sue you in the court. If she said, I don't care, still don't tell. You don't have the right to tell her that we will breach the confidentiality and we will tell the partner by ourselves.
There's partner notification with anonymous, without saying the name. You can send message to the partner.
I heard that.
Supposed to
yes,
HIV
I heard.
positive, so it's better you can come to be tested for HIV.
Yes, I heard that. I heard what you say, that we can notify the partner about anonymous. Yes, but the partner will know that the anonymous one is his or her husband, because
usually the patient
if he has no relationship. Yes, you are right. I heard that there is a debate in this. So in basis exam, when I heard about this debate, I decided in basis exam I will not tell this sentence. I will notify you. No, I will just try to convince her. And if the patient is still in the end, still I don't want to tell the partner, then I will arrange a meeting with my consultant and the infection control, and then they will talk to you more about that. It's not my decision to tell the partner.
Yes, let me clarify it, Doctor.
Yeah.
Yes, you will encourage her first. The first thing. If not, and she is not, she's refusing, tell her we can arrange meeting with you and him, and we will have the way how to convince and to deliver this and share this news with him. Don't worry, we are practicing this before. If she insists, yeah, that time you can breach the confidentiality. We have to inform your partner.
This is breaching confidentiality.
Yes.
This after exposure, Dr. Bassem, or after confirming?
No. All this after confirm. We don't know
after
yet.
Confirm. Yes.
Exactly.
Yes.
We are
Just
anticipating.
we will advise here for safe sex, but we will share
protected sex, and that's it. And also donate blood. Don't share your private tools, your brush.
This is safety. Yeah, this is safety. You should tell her.
Safety, yes.
We are talking about patient of HIV.
But breaching confidentiality, it's if the patient, usually the patient, you couldn't breach confidentiality. Only we are breaching confidentiality if this issue cause harm to himself or to the other. So if he's HIV positive, he cause harm to the others. So you will breach. You have the legal right to breach the confidentiality.
Absolutely right, Doctor. If she will wait and she will be quiet, and we will put her partner at risk to get the infection from her without her permission. No, at this time we have to inform him. Yes, we will breach. So your opinion is correct, Doctora. I respect your practice and experience in UK, and also in bases we are restricted to some rules.
Yes,
yeah. So it is the same, but maybe she didn't understand your opinion earlier. So yeah,
because this is the GMC. This is the GMC rules and ethically.
I agree, and always we are respecting.
The basis is UK exam, so we should follow all the rules.
Dr. Sarah, right? I remember you are the one working in infectious disease clinic
in
UK.
HIV and
so always we are respecting the experience from UK, especially in the area we are talking about. So just to clarify the issue, yes, you're right. But
thank you for sharing that. Really, thank
we
you.
have to breach whatever happened if she refused to inform. Of course, after confirming their positive HIV, not to just to breach and later on the result. No, we are sorry, the result came negative. So this is after confirming, then we will offer two options. Inform him by yourself. No, doctor, I don't want. Why? For example, he's away. I'm afraid. Whatever the reason. If you are worried, we can bring him here with you in co-meeting with our consultant, and we have our way how to inform him. Don't please, doctor. And I need to be away. I don't want him to know. No, he's the one loving you. He will support you. Yes, you encourage her by any way to inform him because he should know. This is what. Yes.
Don't think about the examiner. Want to know how you will convince the patient. So
you
will tell him HIV now. If you can you imagine if maybe one partner he say he has an affair with one and he doesn't want to know his wife that he has an affair. So how to convince him? What do you think if your partner had got from you the HIV?
Exactly.
And then
and he will not receive the medication, and he will be
and this now it's treatable condition. You will
exactly.
So she developed to AIDS. Do you know about AIDS? And then you will explain for him.
Exactly.
So die with simple flu symptoms, and she AIDS, so she might leave her kids without her mother. So what do you think? So you will take it step by step.
Yes, exactly. At the end, you can breach it if she refuses after all these precautions. Yes, you're right.
Daniel, we want to know how you will approach the patient to tell him that he should tell his partner about the HIV. It's not in confidentiality, or they want you to say this. So you will say it at the end. With time. At the end, you can tell him we can give you some time to because we give you a lot of things today and a lot of bad news. This is too much for you today, so we'll give you another consultation and have time to think about.
Yes.
We'll take it like this.
Again, can you put again the rules? Because we got confused.
No, we will not reach to this level, Dr. Sarah.
No.
طيب يا دكتور باسم، الكيس الهسي هي المفروض تكون عارفة عن المرض وعن HIV وعارفة أي حاجة.
Yes. We will not reach to these details. Yes.
No. About the patient exam, we will tell the occupational, right? Occupational health physician has to know, right?
Yes, staff clinic, occupational health team, or whatever. Okay, either this or this.
And GP, no need is to know.
No need at all.
Okay.
Her supervisor and her partner if the result positive, and the occupational health teams. That's it.
And
the details Dr. Sarah mentioned in case you are talking to a HIV patient, not HIV stuff.
Yes, I understand. Yes, if she's telling, because she can raise this question, if I get HIV positive, what you will do with me? This is what I was telling. Yes. So you have to inform the occupational health physician for reallocation, and the GP, no need. And the partner you have to inform, and if she refuses, you will write in the file that he has to be informed, right?
Yeah, and you can arrange another meeting with her and to convince her again and to call her partner, let her call her partner to come, and we'll sit together in a meeting, co-meeting, and we'll inform him by us, not by you.
And the prophylaxis will be before the results, right?
As soon as possible.
But don't give false hope, Dr. Bassett. He will say to her, he is the one who loves you, he will be support you. Just you will say he did his right to know.
No. By my way better. No. Don't say it.
No,
actually, it happened in the United States. Yes, she divorced him and raised the.
It's false hope, not the usual way.
No, you can say I can see that your health is important, and also you're thinking that your wife's health is important, and for your kids, you don't want your kids live with
exactly. And yes.
And what about the rest of Sarah? You will do what? You will do antibody, or you will do antigen in the screening?
HIV antigen antibody. We are doing this.
Both. And then after how many months you will
usually after 3 months.
Okay. The antibodies.
Excuse me, guys.
Yes.
Can I ask Dr. Sarah? In reality, are we going to give the prophylactic post-exposure to every single needle stick, or
no? Yeah. Because
the
needle stick, there is very, very low risk of HIV transmission. So we can offer the patient. Usually, you will tell him that the needle stick, the biggest risk with hepatitis B.
Yeah, 30%. Yes.
So with the HIV, there is very low risk, and especially if there is not too much blood, and the needle, it's superficial, because usually it is a superficial needle and a thin needle. So we'll tell her there is very, very low risk. But if you want to take the post-exposure prophylaxis, you can have it within 72 hours.
This is unreal, but in basis we have to.
Yes, but we will say it. Yes, we give it.
Dr. Basim, allow me to comment only one comment, because in UK they believe that the patient has the right to refuse any medication. So that's why we are always offering. But what is in the recommendations? The recommendations say in needle stick injury we should start the post prophylaxis immediately within 3 days. because the hazards or the side effects of the medication is still less than the catching the HIV itself. So,
because
but in UK, but in UK, always you are offering. You are not going to force the patient to take the medication.
You will tell him there is low percentage have the HIV
because you may be at risk of misunderstanding
and if
by the consultant, by examiner, because basically post exposure is for post exposure sexually where the risk is high. So might be the examiner understand you are mixing up the two situations. So I would go with Sarah telling the patient there is offer like that. If you want to, we can check if you are suitable for that.
Yeah. I am also agree with Dr. Sarah that we should break the thing like this. There is low risk, and exposure prophylaxis is recommended. If it is suitable for you, you would start within 3 days, like this. So it is offering, and still we will tell that the risk is low. You are right, and I am agree with you both.
Okay, so we offer not giving by force or not as recommended. It's just offer.
Yes, just offer. Yes, for anything, even life-saving things, we are offering.
Yes, and we have to reassure here that HIV now is treatable condition, and you can live normal life once you discovered and you started the medication as soon as possible. Yes. Okay. Agree now, all of us.
Yeah, we can tell that we refer you to the infectious disease doctor and the MDT to decide about your management. And if you need prophylaxis, I think that's it.
Better.
Well, Dr. Basim, again, a small comment about the compensation.
Yes.
When you tell the patient that you have a compensation like so, I think also I heard from one mentor that who's working in UK also that it's better to tell the patient, because you are not the one who will decide the compensation. You are not the one. Tell him people in your situation usually got a compensation in this situation if they follow the rules, and after sitting with them in with the occupational health department, and they find that they deserve the compensation, the people usually in your situation will have the compensation.
Okay.
Not a promise that you will get the
compensation. Agree. Yes. Any compensation for any medical issue should be
for
also revised by the team concerned for that, not me.
Yes.
Give him only. We can say we don't have too much information about this, so give you to a specialized team so discuss with you about the compensation and how we go forward with the process.
Yes, I agree.
This is not a doc. I'm working and first time I know now that there is compensation for HIV infection.
Really?
So because
there's no compensation.
Yes, and I will tell you something, Dr. Sarah, that if you delay demanding this, you will lose it. So I have been told by this mentor that you should bring this topic to the patient whenever there is a conversation, like in occupational disease, like in anything else occupational related. You should bring this word or sentence to the patient, and you should also tell the patient if you delay asking about this, you might lose it. So I think they said within 1 month or within 15 days, something like this. If he delay asking about the compensation, then he will lose the compensation. So you should bring this.
But this is after getting the positive result. If she is only at risk, why they will give her compensation? Even in the Gulf and in Egypt, they will not give compensation. Only they can offer them.
I want to tell that also to Dr. Basim. That
no compensation
even no compensation here. After she got
even in the Gulf, which is relatively rich country, they will
in the exam, and she's coming to you after the result, then it will be a breaking news, bad news that she's got HIV, plus also telling her about the compensation. But now there is no compensation actually.
Oh my God! So why they are calling إصابة عمل? Or I misunderstand this word?
No, because
إصابة عمل only. They will give you
Yeah.
the medicine only, Dr. Bassam, nothing else. They will not
They will
give you
give you
money
sick leave
or
only.
لا هي بعد التحليل دكتور باسم حتعتبر شكة عمل بس ما فيش حاجة ثانية.
Sick leave for 1 day only.
I think
Yeah.
حتى إصابة العمل they will not treat any complications. I think only the medication. Even here in the Gulf they are doing like that. I think they are giving only the medication. Even the complication they will not treat.
If you have HIV in a Gulf country, you will be deported. I was working in
Yes. Yes.
Yes,
It will
yes.
be point, yes.
patient
Notifiable.
So up to this point, good night, guys. Good night.
our hospital and then go to the airport. So
Yeah. I'd rather run from this.
Notifiable, you mean? Notifiable here?
Yes. The Gulf they are notifiable and they will deport you. Hepatitis C, I think they will prevent you from work even. Yeah. Hepatitis C and HIV, and they will end their contract and no more renewal of your. Who will be their sponsor?
In Kuwait, any leprosy patient, he was deported. They come to. I was working in the infectious disease hospital there, and they bring the patient, stay in the hospital, and then the police takes them to the airport. So there's no how they give money in the Gulf country. All HIV, there's some infectious disease that should be deported, not stay.
No mention, Dr. Sarah. We are recording this session.
Only. Oh, okay.
No, it's okay.
No, don't worry. You are safe, Dr. Sarah. Don't worry.
Okay, nice discussion. I don't know why all of you not coming in the routine day. You are coming only in the weekend, Friday.
Yes, because we have work. Where are you living, Dr. Basim? You are starting your session when we are starting our sleep.
But really, I didn't see like such discussion before. Very warm discussion about the HIV and the conflict and the debate. And we are waiting for you guys. Why you are not joining us in the other days? Anyway,
Everybody.
Yeah. Okay, thank you all of you. I really enjoyed this session. And we learn a lot from all of you, especially the experience from UK. So I want to ask Dr. Sarah before ending the session.
Yes.
The cold water, I think, reduce the risk or no?
No, it's true. He will when the patient has a needle stick, he need to wash it with normal water.
Normal water, yes. Okay.
Normal running water and clean it, and then go in
No squeeze.
No, he can squeeze. No, I'm not quite sure of squeezing, but normal running water, and I think squeezing, he can squeeze it.
No
squeezing
there. No
I
squeezing.
think, no squeezing.
No squeezing. I'm sure. Not squeezing.
Yes, no squeezing.
Just running water. Yes, just running water. Tap water.
Running water was not squeezing.
No need for cold water. Just clean
exactly.
and But the debate is about wearing 2 gloves.
Nothing.
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 Yeah.
I read also nothing. It will not
nothing.
prevent.
They are not wearing 2 clothes. Also, this is like hadr for the
psychological only.
hospital.
Psychologically, you are wearing 2 gloves for nothing. It will again, if you break yourself, the risk the same. So just for psychological support only.
I mean, don't ask about this in the exam. Don't ask if you are wearing 1 gloves or 2 gloves.
No. It's written there in multi scenarios.
Yes, I know that. But I told you, Ala Al-Hashimi, she is a mentor. She works in infectious control. She's a specialist in infectious control in the UK. So when she gave me this scenario, I asked the patient if the surrogate if she's wearing 2 gloves or 1. She told me, what is the point of asking this?
Yes, exactly.
Nobody is wearing two gloves
yes. Doesn't matter.
So she told me, please don't ask this question in the exam. Because it is not, and also she told me, don't tell the patient that after trying to convince the patient to tell break the news of that he got HIV in another scenario, don't tell the patient, I will tell your partner or I will notify the partner, but you tell the patient that you will have another session with the occupation health department and the social workers, and they will talk to you more about this. Because I believe that they will not accept giving harm to another person. This is the sentence.
Yes.
Yeah.
Okay. Clear now. I think. Any question?
No, thank you. We are also happy to be here today.
Yeah, thank you You're most welcome. Yes. The comment here, I got confused. Who got confused? Just to touch the issue, no confrontation, of course. Okay, anyone got confused?
I got confused, but خلاص clear.
Clear now, okay.
Usually, I just want to say something regarding the GP. I'm working in sexual health clinic. So the first thing, I'm identifying the patient and then tell him, I just want to let you know that here everything is confidential, even for your GP, unless you give us the permission or there is something cause harm to yourself or to the other. This phrase I'm saying in front of every patient because I'm working not in also the sexual health clinic. So the patient, and we are calling the patient by numbers, not by names. And we have a secret system in the
anonymous, yes.
So the GP doesn't have the right to know about the HIV infection or anything that the patient doesn't want to know, to tell him, because the patient usually the patient are taking the HIV medication from the HIV clinic, not from the GP. The GP can give him the blood pressure medication, the diabetic medication, and even admitted patient, when we send the discharge summary to the GP, we'll ask him, you want the GP know about your HIV? If he said no, so no, we won't write HIV in the diagnosis. So this is a clear thing that it's a rule in the UK. This is confidentiality. This is the patient confidentiality. Only we break it if there is harm to himself or to the
or the others, or he accepted that, or he has give you permission.
And yes, and even when we have two partners that married and have sexual transmitted infection, we are not allowed to inform the other partner about the infection, that his partner has infection. This is not allowed. This is breaching confidentiality.
Yeah.
We can send, we have the partner notification. We can send an anonymous message. You have been in contact with someone has gonorrhea, so you must be tested, without saying the name who
the person.
So yes. This clear. I think the HIV topic in the exam, if it will come, is they want to know if you will how you will deal with confidentiality.
Yeah. Yes, exactly.
Making the bad news for the HIV, you shouldn't ask him, you want someone to be with you in this conversation.
Of course, this is prohibited, yes.
Yes, so this is, I think in the exams, they won't take all this time to ask, because we are not, every person is working in his field and know about his field. So they want only to know how you will deal with the patient, how you will try to convince him, and how you will deal with this HIV, which is confidential.
Yes.
This is
Dr. Sarah, what has been twisted from our previous practice about the consent when we ask the patient to take samples?
Verbal only. Verbal consent, not written.
What?
I think so. Yeah.
No written consent, right?
Now in the UK,
written consent.
Taking the HIV test in any patient as a routine from A&E without telling the patient. Now when I'm going to the A&E for myself, when they are checking this crude blood count, renal function, they are taking a sample for HIV because they try to know how many patients has the HIV and they can start the treatment.
So they are doing as a routine.
It's now done as a routine.
Yes.
Yeah, without consent for the patient.
Become aggressive. Why you didn't tell me about that? But I was in the A&E and they were taking me blood, but because I'm doctor, I know that this tube is for the HIV, so I know that they are taking me the blood for going for other complaint. So now they are trying to take the HIV as a routine. Want to decrease the HIV infection because it's
okay. If the patient himself want to screen, he need to be consented.
No, he will say, I want to do an HIV test.
Yeah.
Do it for
So
me.
we're not gonna see scenarios of counseling patients of HIV testing anymore because we are doing HIV for the patient without telling them, just by
So this is obsolete.
But it's not. It's only consent in normal. You want HIV, so you can have it, the test. And the other thing, only the consent for written consent for lumbar puncture. For this thing, need to be written consent.
Yes.
But for the HIV, anyone can want to do the HIV test, he can do it.
Yeah.
Okay.
We're not going to see these scenarios like counseling the patient about HIV anymore.
And all this sexual transmitted infection, they need to decrease it. And also the treatment there is free for all these patients. Because we couldn't make the treatment with money because patient might have the disease and won't say because he doesn't have money to get the treatment. So that's why they are making most of the sexual transmitted infection, and the HIV, the treatment is free. You are not paying for it.
Okay, Dr. Ahmed asked this question. Does now even HIV positive doctor can practice in surgical department without prohibiting in UK?
We have a lot of staff nurse HIV positive and a lot of doctor HIV. HIV positive, and I have a consultant HIV positive, and they are working normally.
Great.
Yes, so this is normal to work, and even if he doesn't want other staff in the hospital to know about him, sometimes we are putting a password that no one can allow to see his notes apart from the treating team. He has one of his relative is other nurse, and he doesn't want to know about his HIV infection. He's not allowed to know about it. So doctors, nurse can work with HIV normally in UK, and I know a lot of nurse and a lot of consultants that are HIV positive and working with it.
Okay, Dr. Sarah, thank you for
شكرا
clarification.
دكتورة سارة يعني
Yes.
والله العظيم مفيد جدا ما
Yes.
أنا ما كنتش بعرف الحاجات دي، بس الصراحة يعني أنا بشوف حاجات كتير ما كنتش عارفاها في حياتي يعني بالموضوع.
بارك الله فيك يا رب يخليك.
Yeah, thank you so much, Dr. Sarah. Appreciated your attendance and try to attend regularly as before. You were regular.
I'm on the 14th of November, so I'm trying, because here the PACES exam, it's difficult, more clinical.
Yes.
You need to know the number, you need to know this murmur, this mitral valve replacement or aortic valve replacement. You need to know post-vestibular neuritis, post-vestibular syndrome from the neurological examination.
Oh my God.
More clinical than...
Yes. Best of luck, inshallah, Dr. Sarah. Allah, inshallah, bless all of us
thank you.
from this test, inshallah, hopefully. Okay, any other question before ending? Thank you again, all of you. See you, inshallah, tomorrow with the
communication session today took 2 hours. Wow, this.
Sorry?
The communication session today took 2 hours, complete 2 hours.
2 hours for, I promise. Sarah, I said in the group, it will be not long as before.
Yes. 2 hours, the longest session ever.
Yes. Yeah, but nice discussion, and I hope all will get benefit from this. Okay, sure, inshallah, see you tomorrow. Thank you, Dr. Sarah, for your scenarios and practice, and so thank you for other Sarahs. We have a lot of Sarahs, mashallah.
Yes.
Okay, see you, inshallah, tomorrow with the clinical day. Good luck and good night. Assalamu alaikum wa rahmatullahi wa barakatuh.
Alaikum salam.